Welcome to the Dairy News and Views podcast, a production of the Iowa State University Extension and Outreach Dairy Team. Our podcast covers current educational, research, and industry tools available for your operation to manage healthy cows and calves while producing the highest quality dairy products. Thanks for joining us today on Dairy News and Views from the ISU Dairy Team. I'm Jen Bentley, Northeast Iowa Dairy Field Specialist. I'm here today with Fred Hall, Northwest Iowa Dairy Field Specialist, as we discuss today's topic. So welcome back to the podcast, Fred.
Thank you, Jan. Nice to be inside with the chores all done on a day like today.
Yeah, thanks for sending the snow our way, and assuming it's going to go into Wisconsin. And talking about that, we're introducing Dr. Sarah Adcock from University of Wisconsin. So we are happy to have her on the podcast today as we discuss disbudding practices and pain management and steps producers can take to stay ahead of consumer concerns and just that changing industry standards for this procedure. So Dr. Sarah Adcock joined the department as an assistant professor of animal welfare at the University of Wisconsin in 2020, and her research includes evaluating how farm practices affect animal behavior, physiology, and productivity, and developing strategies to optimize these outcomes, and also understanding the interconnections between animal welfare, socioeconomic, and environmental challenges on a local and global scale. So a common goal of these research objectives is to achieve sustainable, socially responsible food production that benefits humans and animals alike. So Sarah, thanks for joining us today on our ISU Dairy Team podcast.
Thanks for having me. I'm glad to be here.
Yeah, so you recently did a webinar for our Extension Dairy Team, our Boots in the Barn program, kind of talking about disbudding practices. And can you first tell our audience, the difference in that terminology of disbudding and dehorning, and then what are producers currently doing? I kind of know what's happening here in Northeast, but what are you seeing?
Yeah, definitely. So disbudding refers to stopping horn growth before the horn attaches to the skull. So when the calf is usually less than 8 weeks of age. And then after that time, around 8 weeks of age, the horn fuses with the skull, and a more invasive procedure is required to remove it, which we refer to as dehorning. And another way to think about it is that disbudding involves the use of caustic paste or a hot iron, while dehorning requires tools like scoops, saws, or wires. And then to respond to your second question about current practices, the most recent countrywide data set that we have is from the USDA, which was collected in 2014. So it's about 7 years ago now, so it's not exactly recent, but still within the last decade. And based on those survey results, what we see is that 94% of dairy producers routinely disbud or dehorn their calves. And the hot iron is the most common method. So 70% of operations use a hot iron to disbud, while 16% use caustic paste. And amputation methods like scoops, saws, and wires were reported at 30% of operations. But in some of those cases, it's not being used as the main method, it's used as a last resort for cases of horn regrowth. So on average, these operations are disbudding with a hot iron at about 7 weeks of age, which is at the upper end of when that method should be used. And then in terms of caustic paste, this is done around 2 to 3 weeks of age, which is also older than what is recommended for caustic paste. So it's typically suggested to do it within the first week of life. These are slightly older ages than what is recommended. And then in terms of pain relief, in 2014, hot iron disbudding, well, for the operations that used a hot iron to disbud, they were using pain relief 30% of the time, whereas it was less common with caustic paste. So in 2014, 6% of operations were using pain relief for the caustic paste method. But that was 7 years ago, so it is likely that those numbers would be higher now, but that is the most recent estimate that we have of what current practices look like across the country.
Okay, you gave us some 2014 data. How does what you're seeing align with what veterinarians' protocols are in the current farm program guidelines?
Yeah, so pain management is definitely recognized as an important concern for both industry stakeholders, so producers and vets, as well as consumers. And there was a recent survey in the last few years that showed that the vast majority of producers, vets, and consumers all believe that pain relief should be provided for disbudding. In 2019, the American Association of Bovine Practitioners recommended that pain management be considered the standard of care for all dehorning and disbudding procedures. So that means that across the country, vets agree that we have this responsibility to provide pain control for calves. And so in response to some of these concerns, we've seen changes in the quality assurance programs in the US. And one of these is National Milk's Farm Program. So in their most recent version, in version 4, they updated the standards for disbudding. So now under their mandatory corrective action plan, the calves should be disbudded before 8 weeks of age. And then as part of their continuous improvement plan, they state that pain management is expected to be used when disbudding calves for any method, and that the producer should work with their vet to determine an appropriate pain management plan. So I would expect that with these new requirements, we would see a lot of changes in the data that we saw from 2014. So a decrease in amputation methods, as well as a decrease in the average age of the procedure, and an uptake in the amount of pain relief that's being used.
So Sarah, could you walk us through each of those methods, kind of describing those and what the research shows about those methods, and how you measured that level of pain in those calves, depending on which procedure you used?
Yeah, so for amputation methods like scoop, dehorning, or using saws or wires, we know that these methods are a lot more painful and they cause a lot more tissue damage, as well as a increased risk of infection compared to disbudding methods like caustic paste or hot iron. And since farm is requiring that disbudding is done under 8 weeks of age, there really is no need for amputation procedures to be routinely done on farm. So the hot iron and caustic paste methods are less painful than amputation, but they are still painful. So they both work by causing a third-degree burn that kills the horn-growing tissue. So hot iron causes a thermal burn and caustic paste causes a chemical burn. There's been a lot of research in the last couple of decades that shows that for both of these procedures, there's a lot of pain associated with the immediate hours or day or two after disbudding. So during this time, we see that calves will show changes in their behavior and their physiology that are consistent with signs of pain. So we see that calves will shake their head and flick their ears more, they play less, and their heart rate and their stress hormone levels increase. And if we give pain relief before disbudding for both caustic paste or hot iron, those responses are reduced. So we know from this that both of these procedures are acutely painful, so they cause pain in the immediate hours after disbudding. But we also know that in the case of third-degree burns in other species, like in humans and in rodents, that pain can really last for a super long time. So it can span weeks, months, or in some cases even years if it's a really severe burn. So based on this and knowing that the disbudding wounds take several weeks to heal, so for hot iron wounds, they take about 9 weeks to heal on average. We wanted to look at how long the pain actually lasts during the healing period. So this is a little bit trickier to measure than the acute pain response. And one of the things I like to mention is that it's difficult to even assess long-term pain in humans. So about 1 in 5 people experience chronic pain, but you would have a really hard time picking them out in a crowd based on just looking at changes in their behavior. So a lot of these changes are much more subtle and require really observing the individual for a long period of time. So that's what we did with the calves. We looked at their behavior over 24 hours a day over several weeks. And what we noticed was that the disbudded calves tended to ruminate less and suckled more for 2 to 3 weeks after disbudding. So in the case of rumination, they might be ruminating less because it involves a lot of jaw movement. So that jaw movement might disrupt the horn or the wound. So they might ruminate less to reduce the amount of pain. Whereas with the increase in suckling, which was a little bit surprising for us to find, if you look at other species like in humans and in rodents, suckling actually has a pain relieving effect. What we think is that these calves are suckling more to reduce some of that pain during the healing period. Another way that we can assess pain is to ask the calves whether they will seek out pain relief. So just like if you have a headache, you would take ibuprofen to feel better, the calves might do something similar. So what we did was we asked them, we trained them to associate a rubber teat with pain relief. And this was placed in one side of their pen. And then we trained them to associate another teat on the opposite side of their pen with no pain relief. And what we found was that 3 weeks after disbudding, the calves spent more time suckling from the teat associated with pain relief compared to calves that had not been disbudded. So that was evidence, again, that they were experiencing pain for at least 3 weeks after disbudding. And then another way that we assess pain is to use a device called an algometer. So this actually measures the sensitivity of the wounds by applying a force to the wound and seeing at what force the calf actually moves their head away. So the more sensitive the calf is, the lower the amount of force at which they'll respond. And so based on all these different methods, we found that calves experience pain for several weeks after disbudding. What we see in terms of caustic paste is, well, we don't have any studies that have looked at the long-term pain response to disbudding or for caustic paste disbudding. So we can't really say how long the pain lasts in terms of caustic paste, but we do know based on the fact that it's a 3rd-degree burn and the fact that it produces a similar acute response, that it is likely that the pain lasts for some time after caustic paste disbudding as well. So we don't have any direct comparisons, but we do know that both are painful, but they are both acceptable methods compared to amputation procedures.
And Sarah, I'm going to throw in another question here along with that. I have a lot of producers that are moving to paste because for simplicity of applying it, teaching employees to do that versus maybe using a hot iron. What kind of things or reactions are you getting from producers or employees on these different types of methods? Do they feel one is maybe more acceptable than the other, or what are your thoughts?
Yeah, so paste is definitely gaining popularity because it's simple to apply, and it doesn't create such an immediate reaction as hot iron disbudding does. So it creates the impression that it's a less painful procedure, but the caustic paste takes a longer time to set in. So it's still creating pain, but it doesn't produce that same acute response that hot iron does. It's gaining popularity for that reason. But there are a lot of considerations to take into account with caustic paste because it depends how it's applied in terms of how effective it is, and then also the risk of it actually running into the eyes or transferring onto other body parts or other calves is also a really important consideration to take into account. And that depends both on the age of the calf, so when you're actually applying it, as well as the amount that you're using, and then the environmental conditions as well. But yeah, I would say that it has its advantages in terms of how easy it is to apply, but there are a lot of other considerations for it to actually be used effectively.
Right. Yeah, and I know on our webinar, we had some comments of people on what ages they were using the caustic paste. So that kind of leads me to my next question about, you talked about some of the recommendations on what age we should consider these practices. And I guess when I'm working with producers, I like to, try to avoid that weaning period. So if their weaning period is 6 weeks of age or 8 weeks of age, can they try to do it 2 weeks ahead of that so they're not causing additional stress when we start to take milk away and cause a lot of different issues. So what age should we consider these practices?
Yeah, that's a great question. So, well, we know from the farm program, it requires that it has to be done before 8 weeks of age. But after that age, it requires more invasive procedures to remove the horn bud. But I would agree, we don't have a lot of research looking at within that 0 to 8 week window what the best age is. But I would say in terms of erring on the side of caution to disbud by 6 weeks of age, which would reduce the chance of the horn regrowing and then also avoids it overlapping with the weaning period. So hot iron disbudding can be done as soon as the horn bud is visible, so within that first week of life, and then up until 6 to 8 weeks. Whereas with caustic paste, this should really be done in the first couple of days after birth. So as the calf gets older, they're more mobile and there's an increased risk of transferring paste onto other body parts or other animals. So it should really be done in that first couple of days of life. So they're less likely to be able to scratch the paste off or put it onto other things. And it actually has been, for that reason, because of its ability to transfer onto unintended body parts or other calves, it has been banned in some countries in the EU and in Australia, I believe. So caustic paste has a very limited age range when it should be used. And there is also this common belief that younger animals feel less pain, but there isn't any scientific support for that. So they're having a few studies that have compared responses to disbudding at different ages. And what they all find is that the calves respond in a similar way, no matter how young they are. So we know that calves experience pain no matter the age that they're disbudded at. So the main advantage of disbudding near birth would be that it can make handling easier, but pain control is definitely needed at all ages. And then another consideration is that we know from other species like rodents is that experiencing pain near birth can actually increase your sensitivity to pain as an adult. So if that is the case with disbudding, and we're still working on figuring that out, but that could be a potential advantage for using a hot iron. since we can use that safely on animals that are up to 6 to 8 weeks of age, rather than caustic paste where we can only do it near birth. And then there's also some other factors besides pain that we should consider. So if we are disbudding within those first few days, we risk disbudding calves before we can really be confident that they have horns. So if you are using polled sires, it might actually be better to disbud at a later age rather than just disbudding everybody at a very young age if your goal is to increase the number of polled animals in your herd. And then another factor is the risk of scurs. So if you're disbudding newborns, I would recommend clipping the hair so you can identify the bud. You have a better chance of getting the iron or the paste on the actual bud.
You kind of led us into the next question here on pain relief or pain management as we remove that material. It sounds like it's becoming a thing in practices in the dairy community. Can you walk us through what options producers have for pain management?
There's definitely a scientific consensus that disbudding is painful and that pain relief should be provided. And it's generally agreed that the pain from hot iron and caustic paste methods should be treated in the same way. So there has been a little bit of debate in the past about how to treat pain from caustic paste disbudding, but there's been more research recently, and we can now say that a combination of local anesthetic and a non-steroidal anti-inflammatory drug, or NSAID for short, is best practice for both hot iron and caustic paste disbudding. A local anesthetic works by numbing the horn buds before disbudding. So this would be done by injecting lidocaine, about 5 milliliters, on each side of the head to produce a block of the corneal nerve, which is the nerve that provides sensation to the horn bud. And then that block should be given about 10 minutes before disbudding to allow it time to actually numb the bud. It will last for about 2 to 3 hours. So I recommend just going through the whole, all the calves, giving the block first, and then coming back around and disbudding after, so you're not spending time waiting 10 minutes in between. And then since it is only effective for 2 to 3 hours, it's recommended to give an NSAID to extend that pain management. There's 2 main options for an NSAID. There's meloxicam and there's flunixin. And between the two, meloxicam is the most commonly recommended since it relieves pain for a longer period of time, so up to about 48 hours, and it also has the most research supporting this use. So that can be given orally as in tablet form, and a dose of about 1 milligram per kilogram is recommended. And it can be given at the same time as the corneal nerve block. So both lidocaine and meloxicam are prescription drugs, so they can be obtained through your herd vet. And the other thing to consider is just an NSAID is not a substitute for a corneal nerve block. So if you go to the dentist, for example, and are getting a root canal, they'll give you an injection of lidocaine for the procedure itself so you don't feel anything. And then afterwards, you'll get an NSAID to help with that longer term pain. So it's the same idea with disbudding, where the lidocaine is needed to actually make sure that the animal is comfortable during the procedure, because the NSAID won't numb the horn bud. You really need to have both in order to provide the most effective pain relief.
So Sarah, based on these methods, are we seeing processors or retailers requesting certain practices, or are we needing to consider alternative methods to disbudding at some point?
A couple alternative methods that have been looked at, and they haven't been promising. So one method is to inject clove oil under the horn bud, and another method that's been looked at is spraying liquid nitrogen over the horn bud. But both of those resulted in really high levels of horn regrowth. So I currently can't recommend those as alternatives, but there might be ways to refine them to make them more effective. And then another alternative is to breed polled animals. So that would avoid the need for disbudding altogether. Hornlessness is a dominant trait that occurs naturally in cattle, but it's only present at a very low frequency in our dairy breeds. So what we can do is selectively breed for polled animals by using sires that carry the polled gene. And this is gaining some popularity in the dairy industry, but it's still a niche market because of the risk of increased inbreeding, and then also the slower genetic improvement because these sires are rare. But the number of polled sires is growing. So that gap in genetic merit between horned and polled animals is also shrinking. If welfare concerns about disbudding increase, we can also expect to see growing demand to incorporate polled genetics into the herd. So animal health organizations like the AVMA and the World Organization for Animal Health both recommend breeding for polled cattle whenever possible. And in the US, we're seeing some of the nation's largest dairy processors and retailers, so Walmart, Starbucks, Danone, General Mills, they're all encouraging suppliers to integrate more polled cattle into their herds. So this is not currently being enforced in any way, but I do think that it's something to keep on your radar and just try to select for if possible.
Yeah, Fred, I don't know about Northwest Iowa, but in talking with producers, I know, they're starting to consider some of those polled genes, but like Sarah said, just some of that restrictive as far as what genetics are out there and, advancement in your genetics, if you decide to just use strictly polled genetics. Do you have any thoughts on that, Fred?
From what we're seeing in the proofs, we've got a pretty good gap between the battery of polled and the non-polled bulls. And I think Sarah's right. As that gap diminishes, we'll start seeing producers put a higher value on it. It can be pushed to the forefront if one of the major buyers says, we won't buy milk from herds that remove horns from animals, because we know that it's a safety issue.
Yeah, so Sarah, during our webinar, you had also showed some great videos of, just going through the correct procedures for pain management and disbudding, walking through how to properly do that, because these practices can be done on farm. And if we train our employees how to do that, it's a very practical solution. So where can producers find those videos?
Yeah, thanks for mentioning that. So my PhD advisor, Dr. Cassandra Tucker, who's at UC Davis, and we put together this video that is about 8 minutes long, and it's intended for employee training to walk through the steps for pain management for disbudding. So it goes through the supplies that are needed, the steps for giving a corneal nerve block, and then meloxicam, as well as disbudding with a hot iron. So that is on the UC Davis Center for Animal Welfare YouTube channel. And then we have it in both English and Spanish. So both options are available.
Sarah, thanks for all the great information we've shared today. And as we conclude, if you could boil it down to a single take-home message for producers, what would that be?
Yeah, I would say that disbudding is painful, and pain relief should be provided no matter the method or the age, and that it benefits both the animal and the producer alike, as well as the industry at large.
Yeah, great information, Sarah. And I do want to note that the webinar that we hosted with you a few weeks ago, I will link that to this podcast episode so people can view that. And if they want to look at those videos, I also did link those there as well. So I think those are really great training videos to keep in producers' back pocket as they hire employees or just for themselves as well. But thanks again for being on this podcast, Sarah.
Oh, thanks for having me. It was a pleasure to speak to you both.
And once again, we'll thank our audience for joining us today and look forward to visiting with you on the next Dairy News and Views from ISU. This institution is an equal opportunity provider. For the full non-discrimination statement or combination inquiries, go to www.extension.iastate.edu/diversity/ext.